So one of the big things that I see, especially from new clients coming in, I want to retire before 65. And they either say, I don't because, or I'm scared to because. And the thing that comes right after that is health insurance. And when I start showing them what their options are, all of a sudden their mindset shifts to, now let's look at the portfolio and things that actually matter. Can we afford to retire? Because this insurance thing is not as scary as I thought. And
Mhm.
so why don't you tell us a little bit about how that works, especially unique to us in Pennsylvania, and how that might be different from what they're used to.
Okay, so if you're planning on retiring prior to turning 65 and you need insurance maybe to bridge you for a couple years until you hit 65 Medicare age,
Yeah.
you could either opt for Cobra through your employer, which is basically you paying both the employee and the employer's contribution for your healthcare.
Yeah.
Healthcare is, I think, the biggest cost for employers in today's day and age. It's very expensive to go that route, but you keep your same plan. So that's an option. There are timelines on how you can do that. The other option is you go to the state-based exchange. So Pennsylvania and a couple other states have state-based exchange. Ours is called Penny. So when you hear people talk about like the exchange or Obamacare in Pennsylvania, that is Penny. That's our state-based marketplace for health insurance, and different insurance carriers can choose to offer their products or plans through the state-based exchange. And the other thing is why we have this big misconception of, is it affordable? There's no way it's going to be affordable. Um, is because penny plans are based on your income.
Yep.
This is also why you can talk to your neighbor and they
Yeah.
can be paying a very different premium than what you're paying.
Because it's tied to your income. This is where the eyes get big when I start modeling things out for people retiring before 65. Is now you have some planning opportunities to
Mhm.
actually manipulate what your income is before you get to 65. And some ways to do that is withdraw from certain types of accounts that keep your taxable income lower during those years. And that keeps your health insurance significantly lower. You're still spending the same amount, you're still cash flowing the same amount to yourself, but we can manipulate what your actual taxable income is for those few years so that your premiums are much lower and affordable. And then when you hit 65 on Medicare, then we can pull the other levers and now your
Mhm.
taxable income goes up and it doesn't affect you as much. And it's something that when it's planned properly can make the health insurance very, very affordable, even for people that have big retirement accounts and are actually spending quite a bit in retirement. Well, Rick, we're gonna spend this much in retirement. It's too much. That doesn't have to be taxable income. When you start manipulating where those dollars are coming from, uh, pre 65, oftentimes, and again, it depends on the client situation, but oftentimes I can make your taxable income look a lot lower
Mhm.
than the money that you actually need to live on for those few years, keeping your insurance down. And we're talking about a big deal here. I mean, I looked up, uh, just as an example, a married couple at 62 years old apiece, $100,000 income. They're still eligible for, in this case, $1,100 a month tax credit through Penny.
Mhm.
$1,100 a month tax credit through Penny, and that's at $100,000 income. So you can imagine two people in their early 60s retiring on less than that. And that
Mhm.
doesn't mean they're spending less than that. That means that we're showing a taxable income less than that. You can, you're talking about significant savings